And with that, I'm going to hand over to a really good friend of mine who didn't change her name on her screen, but she's actually Dr. Jyoti Sukral. So, Joe, over to you.
All right, great. Hi, guys. So like Ness says, my name's Joe. I'm in a little, well, supposedly sunny town south of Durban called Amanzimtoti. And at some point, I've got to learn to say no to this Dr. Kathrada whenever she asks me to say something. Because all you people are so clever and so learned, and I'm just like a little general practitioner in a little town doing her own little thing. Look, I mean, I'm not going to get into any of the theory, virology, etc., of the whole COVID thing. I think 22 months down the line, you clever people know everything. So what I'm going to aim at doing is just sharing what I've been seeing on a clinical level in my practice since the beginning of December. So we learned another variant of the Greek alphabet called Omicron or moronic, or whichever one we want to call it. And for me, the pre-seed version that I've come to learn in the last 2 weeks is that, we know it's a highly infective, highly transmissible strain. It has been mildly symptomatic compared to the Delta strain prior to that. There's been minimal systemic fallout. I've dealt mainly with the secondary bacterial sinusitis or laryngotracheitis kind of picture. Nothing really of concern. And the nice thing was to see that sudden decline in the Delta variant that was horrid to treat when the COVID storm hit in the second week. So that was all the positives regards the Omicron. Let me tell you, sorry, I'm a little bit frazzled today because that's all just changed in the last 2 hours. I've admitted my first COVID patient, I think, after about 4 months. So back to that case that changed all my concerns regarding this highly infectious, very mild strain that we don't need to worry about. In terms of the clinical setting, I think the big thing for me is having to adapt, because now we weren't just dealing with a strain of another new strain. We were dealing with another new strain in people that have chosen to inoculate. I'm still one of those old people. I don't call this a vaccine. For me, it's either a jab or an inoculation. So adding that variant to clinical practice has been a steep learning curve. And for me, my biggest concern was obviously, post-jab, we have patients that we know for a fact we have decreased circulating natural killer T cells. So what was going to be the fallout for us clinically in terms of all the other viruses that are normally kept in check with these natural killer T cells? What would be the implication for that? And then the second biggest thing for me, and I think we're seeing it clinically, I don't know if you're seeing it anywhere else, but we know that the SARS-CoV-2 spike protein in those jabs actually impaired the repair of DNA that's damaged. So for me, the concern was, if I have comorbidities, how do I now handle patients that don't just present to me positive with a new strain, but positive with a new strain and having the deficits of their natural immunity being being decreased. And I think my fears were highlighted when I think around the 12th of December, Dr. Rob Malone presented that of the 110 cases of Omicron that they had seen in the US, 66 of them were patients. Of the 110, the 66 that tested positive, 52 of them were fully inoculated. So that doesn't bode for a coincidence as far as I'm concerned. If something repeats itself, it's not a coincidence. It bodes to statistical significance. It's a pattern. It's something we should be looking for. And then also the CDC in that same week released figures that 78% of their Omicron strains were actually people that were fully inoculated. So once again, that just brought me to the concern as to what is it that I'm seeing on the ground. So sorry, that's my child. So just while I was setting up for this meeting, I was running around and I've just pulled a few of my files. Um, I'm South Africa. So, you know, the interesting thing is we've had no deaths apparently from the Omicron strain. I think there has been one reported in the UK. I haven't received any confirmation. I haven't seen any literature on it or whether that patient was inoculated or not. So it being highly transmissible, when this all started, I said to my patients, please just go out there, gather your natural immunity, get this over and done with. It's a vaccine to you, consider it a gift. But what I am noticing, which is, and I've just done a quick analysis of like the last 15 cases that I've had come through this week, is all my patients, 0 that have tested, and I've just looked at families, have tested positive. Every person that was the first positive has been a vaccinated patient. I'll give you an example. Dad vaccinated due to work mandatory. He tested positive on Saturday. I've just had the daughter and mum who are unvaccinated test positive in the last hour. I have 2 parents that are vaccinated, once again, due to work mandation. Last night, their 3-month-old baby developed quite a high temperature, which is concerning. Baby this morning on rapid has tested positive. I can go on. I've got a list of 15 families in this week that I've quickly written down. Every single patient that tested positive in that family first is a patient who's vaccinated. I've had grandparents vaccinated that have then subsequently had Omicron, and now all the kids and grandkids are testing positive. There's 5 adults and there's a baby who, 1-month-old baby. So all of a sudden, I'm sorry, this was just stuff I've put through together quickly. I'll put it into a proper format and I'll forward it to Nasiba so that if anyone wants to have a look at it, you can browse it. And it's just a little bit chilling for me to notice that all my patients that first tested positive are my patients that have gone for their jabs or their boosters, etc. So moving on, where I was quite blasé in the first week, I think, of this Omicron variant breaking, I'm a little bit hesitant, seeing that I've just admitted in the last hour my very first patient after a very long time. He's a gentleman who developed minor rhinitis symptoms and an itchy throat on Sunday. He called me on Monday, and we've just been treating it essentially with his vitamins, and he asked for an antibiotic because he is a 84-year-old gentleman with known underlying asthma. This morning I got a frantic call from the carer to say he really wasn't looking well, he wasn't breathing well, and he was quite rigid. And so we've tested. PCR is negative, his rapid is positive, his rapid antigen, and he's got an interleukin 6 count of 47 already. This is now 72 hours from onset of symptoms. The interesting thing will be is he truly Omicron or is he Delta? I don't know whether they'll be able to do the gene analysis. So I think we have to be a little bit where even my patients in the first week, I said to them, blow your nose, take your vitamins, get some sunshine, do some grounding, rest, get better. I'm finding that in the last 3 days, I've gone back to being a little bit more cautious, and I've reinstated patient use of ivermectin routinely on these patients. So, that bodes to what I'm doing currently in terms of medical management. And that has changed quite a bit from what we saw with the Delta variant. So I've gone back to using ivermectin on my patients that are positive, and I'm using ivermectin prophylactically with close positive contacts. Like Nasiba says, the vitamins go without saying. At least 2 grams of zinc, vitamin C in a day, 24 to 50 milligrams of zinc, and 5,000 units of vitamin D is a given. I have also been using quite a lot of Disprin initially with this Omicron strain, and I am now reconsidering that. My patients that have the comorbidities of the obesity, the asthma, the diabetes, the hypertension, which is actually quite a large proportion of my practice, seeing that it's a fairly geriatric practice, I have taken going back to prescribing Xarelto from 2 days ago. So where we went from a very mild disease, and I was quite flippant, for want of a better word, in the first 2 weeks of December, I'm just a little bit hesitant as to what this Omicron variant might bear for us in terms of further morbidities in patients that have now had these jabs or these boosters. So, you know, as a précis of treatment, I think ivermectin is up there. My vitamin C, D, and zinc is up there. I am going back to anticoagulants, either your novel oral anticoagulants or Disprin. I am using the NAC twice a day. And in fact, I've had some patients coming in for intravenous vitamin C and glutathione startups that are feeling miserable. So I'm using like at a minimum currently of about 5 grams of vitamin C intravenously with about 3,000 milligrams of glutathione, as well as neurobion and a Mayer's cocktail, which has your magnesiums and your trace. And I'm finding patients are doing really well. I think my biggest concern is, and maybe somebody's going to shed light on that later on, is why are we seeing the Omicron in a disproportionate percentage in our jabbed patient versus the non-jabbed patients? Is this truly a new variant, or is this some form of adverse vaccine fallout variation that is being passed off as another variant of COVID? I don't know. That's just my thoughts, because nothing's adding up. If we do the maths, and all my patient zero that tested positive has been vaccinated. So yeah, that's just basically clinically where we sit at the moment. And maybe as we go along, somebody can address it for me. And that's basically all I have to say, Ness.
Thanks so much for that, Joe. I was just trying to unmute there, just answering question. I have your first question, and I'm quite sure that there are others. So my first thing is, this patient that you've got that you've just admitted, there's no way of telling whether that is the Omicron strain, firstly, because we don't do that, right? So it could have been something else. And also the patient could easily have another two viral infections. It doesn't necessarily have to be just COVID.
I'm sure we will do a full respiratory panel in hospital as well.
Please.
But my concern is, I think, and that's my take home from this. I've been a little bit blasé about this strain. We need to not forget that there are other possible deadly viruses or illnesses we need to take into just say, oh, it's all Omicron, you'll be fine, go home and blow your nose. I think we need to take cognizance of comorbidities firstly, and the fact that there are other illnesses that can make you quite ill while concomitantly having COVID.
And then I want to just ask, just to confirm, did you say that this patient that you've admitted, was that a vaccinated or unvaccinated person? Vaccinated. At the end
of his neurologist for his Parkinson's, that he had to be vaccinated, yes.
Right, so he's got 2 doses of Pfizer, right?
Mm-hmm.
Right. So that was one of the discussions we had in our World Council for Health Med and Science meeting yesterday, in fact. We were talking about the fact that there has been all this talk that taking the jabs will actually cause, besides breakthrough infections, because it affects your immunity, we now know that it also can affect your innate immunity. So it will be very interesting if you can post on our roundtable, as soon as you know the respiratory panel, if maybe this patient has got other viral infections or whatever else you find, so that we can also follow up, so we can know. So perhaps it is not that the Omicron is not mild, it's perhaps that the vaccinated person is now being more susceptible to other infections. So a physician friend of mine told me here in Durban that they're seeing a lot of H1N1 at the moment. So perhaps also check that. So they're seeing a lot of that. She's seeing that way more than she's seeing COVID. And I said this before, but she was a complete pro-vaxxer, was telling me and my staff all to get vaccinated, even though she had COVID, she had the vaccine, and she is only seeing side effects of the jab in her hospital now. So perhaps, you can tell your patient to tell us what's going on in the hospital. So while he's there and you get to know what's going on. So because they don't tell us the real story, right? So that would be—
I don't understand, like, I could find figures for the CDC and the US, but in South Africa, nobody will divulge the patients that are being admitted or are ill, what their vaccine status is. So I don't understand why the secrecy.
Yeah. Well, now what we're saying is, what is the common thing between the unvaccinated and the vaccine free? The answer is none of them will be fully vaccinated. So that's what we have in common. So neither whether you've taken a jab or not. So that's why they keep changing the figures. So that's why it's going to be so difficult, because even when they put up the stats and they'll say that all the patients have been unvaccinated, that's why they're in hospital. We need to start asking, what does unvaccinated mean? Because now they change it. So 1 doesn't count, 2 doesn't count. So at the moment it's 3. And yesterday, Dr. Stefan Becker, who's going to be speaking later on, he told me that in some countries they're giving 6 now. 6. So I'm just waiting to see that but they're giving 6. So if there's anybody else who has any questions for Dr. Joe or want to add any comment to our discussion regarding the strains and what you're seeing in your country or what's going on, please feel free. You can just raise your hand. Just make sure that your camera is on and your name is in full, so I know who you are. And then you're welcome to a comment or to ask a question. If there's anybody, this is a panel of this, we've got, it's our roundtable discussion. So after every presenter, you will have a chance to ask a question. So if there's anybody who has a question for Dr. Joe or just a comment, please feel free, just raise your hand, or you can post your comment in the chat and Joe will just have a look, see there. Okay, so there is a comment here, which I'll just read for you, Joe. Thank you, Dr. Joe. Very interesting and important to get experience on the ground. My personal recommendation when I get inquiries to treat any symptom, whether due to Delta, Omicron, as though it is COVID, and to use the ivermectin FL-CCC protocol with the addition of NAC, curcumin, and when possible, and additional supplements mentioned by Dr. Kat. Perfect. Thank you so much. Exactly. We need to treat each patient individually, and that's why I'm quite keen to know what happens with your patient. But nonetheless, we're going to be praying that he has a speedy recovery, and hopefully his experience will not go in vain. And somebody should tell the neurologist, right, the one who recommended the jab, that he's now in hospital.
But I think they know that the patients that are coming through.
Yeah, we need to just do our bit, right, Joe? We never know whose heart we're going to turn. So we'll just try.
Elbow to your trachea or something. Yeah.
But we'll do what Jackie says. We just tell them to focus, right? F off because you're stupid. But anyway, we'll still try. We'll still try. Thanks so much for that, Joe.